Throughout this entire assessment, I will be checking the skin for color, temperature, moisture, turgor, edema, texture, bruising, scarring, lesions, and nevi. I'm going to start by looking at the head. So the head appears normal to cephalic. It's in good midline position and symmetric. I'm going to move on to the head and the scalp. Hair distribution is good, hair color is good, hair texture is good, not brittle and dry or anything like that. I'm going to palpate the head. I'm palpating for tenderness, for any depressions, lesions, masses, and checking for infestations, which I don't see. Don't feel any masses, lesions, or depressions. Do you have any tenderness?
No.
Okay. I'm going to move on to palpate the temporal arteries. Any tenderness?
Nope.
Okay. Then the lymph nodes. So we are going to go preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. And I don't feel any enlarged or swollen lymph nodes. Okay, next we're going to check your cranial nerve 5 for motor. So I'm going to feel your masseter muscle. Can you clench your jaw for me? And the masseter muscle is nice and symmetric. Next I'm going to check sensation. So for this, if you could close your eyes and tell me where you feel.
Forehead, left cheek, right cheek.
Perfect. Next, we're going to check cranial nerve 7 for facial symmetry. If I could get you to smile for me, frown, raise your eyebrows, puff your cheeks, and puff your lips. Perfect. Then we're going to move on to the ears. So ear, we're checking bilaterally for shape and position. They're in good position. The shape is normal. We're going to palpate the pinna for masses in the tragus. No masses felt. And do you have any tenderness in either area?
No.
And no tenderness. Next, we're going to check the auditory canal. We're checking for any obstructions. So no obstructions, no discharge, no swelling. The redness in the tympanic membrane is in neutral position and pearly gray. Same for the other ear back. No obstructions, redness, foreign objects, discharge in the tympanic membrane is neutral position and pearly gray. And or opaque. Okay. We are going to test with the whisper test. So if I could get you to cover your other ear.
1, 2, 3. ABC.
Perfect. And then we are going to do the Weber and Ryan test. So we're going to test for, this is the Weber and the lateralization. So let me know if you can hear it equally in both.
Yes.
Okay, and then we're going to do the Ryan test to check bone conduction and air conduction. Whenever you cannot hear anymore, let me know for bone.
Okay. Okay.
Okay, so air conduction was greater than bone conduction by 15.
Okay. Okay.
Perfect. And in the left ear, air conduction was greater than bone conduction as well. Okay, now we are going to move on to your eyes. So I check the conjunctiva and sclera for any lesions, discoloration, redness, or discharge, which I don't see any. And then I would check the eyebrows, the palpebral fissures, and the eyelashes. Everything looks good. So we're going to check cranial nerve 2 with the Snellen chart. So if I could get you to cover one eye and read the lowest line that you can read.
LTF-PH.
Okay, and if I get you to cover that and read it backwards.
HPF-TL.
Perfect. So that was your gross visual acuity, and you got 20/20 in both. And then I'm going to check your peripheral vision, so if you could stare at me and tell me what I'm holding up, what number?
3.
Perfect.
4.
Perfect. Okay, next I'm going to check your pupillary response, and we're going to do cranial nerve 3. We are also checking for accommodation and convergence, so we're going to see. Good, so both pupils were round and reactive to light, and then accommodation and convergence, we're going to watch it close. Checking to see if the pupil constricts. Then we are going, that was That's for cranial 3. For cranial nerve 3, 4, and 6, we are going to test for conjugate gaze and look for extraocular movements. So if you could follow. We're looking for nystagmus, extraocular movements, and no nystagmus noted for here. Perfect. And then I'm going to check for your red reflex and internal eye, checking for any red reflex and hemorrhage. Red reflex was noted in both, and no abnormal internal structure problems like hemorrhage. Okay, and now we are going to move on to the nose. So we're checking to make sure that it's straight and midline, which it is, and then we're going to check patency. So if you can hold one there and blow, and opposite. And then we are also going to palpate the frontal and maxillary sinuses. No inflammation. Do you feel any tenderness?
No.
Perfect. Okay, next we are going to assess the throat and mouth. I can get you to open. Perfect. So I'm checking the lips, teeth, gums, buccal mucosa. Everything's nice, moist, and pink. And then the palate, the tongue, under the tongue, the floor of the mouth, the ciliary ducts, the posterior pharynx. Can you say ah? So tonsils are +2. And then we are also going to say ah one more time to check cranial nerve 9 and 10 to make sure the uvula and soft palate go up. Perfect. And they rise symmetrically with phonation. We're also going to check cranial nerve 12. So can you stick your tongue out? So tongue is midline and no fasciculations or muscle twitching. Last, I'm going to check for TMJ. So if you could open and close your mouth. So no crepitus, subluxation. Do you have any tenderness?
No.
Or tenderness for TMJ. Also no redness or swelling, discharge, nasal drip, or anything in the posterior pharynx. Okay, so next I'm going to check your skin. So I would check neck, all skin. I would check to see if the trachea was midline, which it is. I'm going to palpate the thyroid gland. Good. Any tenderness there?
No.
Thyroid gland was not inflamed. And then I'm also going to feel for the carotid. Good. And then listen to the carotid with my felt for any bruise. Good. No bruise noted. We're going to check neck range of motion. So can you flex for me? Extend, hyperextend, lateral and rotation. Perfect. We're going to check cranial nerve 11, so shoulders against resistance. Perfect, and that's 5 out of 5. And I'm going to get the patient to turn to check posterior chest. So I would check all skin, check for any signs of respiratory distress, so tachypnea, retractions, use of accessory muscle, cyanosis, nasal flaring, and I don't see any of that. No abnormal deformities. Chest is symmetric. I'm going to palpate chest expansion symmetry. So breathe in. Perfect. And I'm going to palpate for tactile thermitis. So can you say 99?
99.
Perfect. And vibration was symmetric for tactile thermitis. And then I'm going to percuss over the intercostal spaces, making sure not to get over the scapula or ribs. So I'll give us dullness. Good. Her tympani. And then I'm going to listen. So I'm going to start above the scapula. Deep breath. Perfect. All breath sounds are clear. Now we're going to check for egophony. So I'm going to get him to say E, E, E. the E sounds remained an E, not an A. And now we are going to check for bronchophony. Can you say 99?
99, 99, 99, 99.
Good. And when you say 99, it was nice and muffled like it should be. And then we're going to check whisper pectoriloquy. So if you could say whisper 1, 2, 3. Good. So I can tell that the patient's saying it, but I can't hear it, which is a good thing. Next, I am going to get him to turn, and I'm going to check anterior. So I check anterior chest skin. And then I am also going to listen to his anterior chest. Deep breath. And then I don't see any deformities of his anterior chest. It's nice and symmetric. I'm going to feel for chest expansion. Good, and his chest expansion was nice and symmetric. And then I'm going to feel for tactile firmness. Say 99.
99, 99, 99.
Perfect. And the vibration was nice and symmetric. Next, I'm going to listen to the heart. So making sure to listen to my 5 areas with the diaphragm and the bell. So we're going to go aortic, which is right second intercostal space. Pulmonic, which is left second intercostal space. Herb's point, which is third intercostal. Tricuspid, which is fourth intercostal. And mitral, which is fifth intercostal midclavicular. Okay, then I'm going to find the point of maximal impulse, the PMI. And then I'm going to place my bell and listen to it for 1 minute. And then I would say the rate and rhythm noted. Then I'm going to listen with my bell in the 5. So aortic, left second intercostal. Pulmonic, second intercostal. Herb's point, third intercostal. Tricuspid, fourth intercostal, and then mitral, fifth intercostal, midclavicular. Okay, and then I'm going to get my patient to lay down. So I would inspect for any heaves or lifts, which I don't see any, and then I'm going to auscultate for, or palpate first before I auscultate over my auscultation points. So aortic for any thrills, second intercostal, pulmonic second, Herb's point third, tricuspid fourth, and fifth is the mitral, and I don't feel any thrills. And then I'm going to listen again with my stethoscope. So no thrills, or thrill spelt, and I'm going to listen. Aortic, second intercostal, pulmonic, second intercostal, Herb's point third, tricuspid fourth, and then mitral, fifth intercostal, midclavicular. Herb's third, tricuspid fourth, mitral, fifth intercostal. Okay. Then at a 30 to 40 degree angle, I would have him sit up and I would check for JVD, distension, or pulsation, and none is noted. And then I'm going to check his abdomen. So I would check the abdomen for normal contour and symmetry, which his is. I would then auscultate for bruise. With my bell. So aorta. Renal, iliac, femoral, and femoral. Okay, and no bruise hurts. Now I'm going to listen to all 4 quadrants, starting at the right lower. Okay, and normoactive vowel sounds were noted. Then I am going to palpate all four quadrants, doing mostly tympani because of the gas in the belly. Okay, and then I'm going to palpate. For any masses which I don't feel stomach is not distended, do you feel any tenderness?
Nope.
Okay. And then I'll palpate for the liver. No enlarged liver felt. And no enlarged spleen felt. Okay, and then I'm going to get the patient to sit up and turn this little. I'm going to check for CVA tenderness with percussion. So I'm going to go to the 12th rib, next is spinal cord, and then any tenderness?
Nope.
Okay. And then next I'm going to go to upper extremities. Okay, so I would first start by inspecting the hands and fingers. So I'm inspecting the joints for any redness, tenderness, edema, swelling, nodules. Any tenderness?
Nope.
Any tenderness in the wrist?
Nope.
So no nodules, deformities, edema, redness, swelling, crepitus, but they are all symmetric. Okay, I'm going to check capillary refill, and it's less than 3 seconds. And I'm going to feel your radial pulses. Okay, and they're nice and strong symmetrically. Overall, his hands and wrist and fingers are warm. They're not tender. They're not red. Skin integrity is good. And no edema is noted. So now we're going to check range of motion for our hands. So let's do fingers first. So we're going to do flexion, extension, hyperextension, abduction, adduction, and then thumb opposition. Perfect. Can you grip my hands and squeeze? 5 out of 5 hand grip. Now we're going to do our wrist. So wrist, we're going to do flexion, extension, hyperextension, ulnar deviation, radial deviation, and then rotation. No redness, swelling, deformities, tenderness, nodules. They're symmetric though. Then we are going to go to the elbows. So I check the elbows for any redness, swelling, nodules, deformities, which I don't feel any. Do you have any tenderness?
Nope.
No edema noted. So then we're going to do the range of motion for the elbows. So flexion, extension, and then hyperextension. Perfect. And then we're going to assess the strength of the bicep and the tricep. So I'm going to get you to pull. Good. 5 out of 5. And then push. Good. 5 out of 5. Okay. Next, I would inspect and palpate the shoulders. No redness, tenderness, nodules, deformity, swelling, or edema. And then we're going to do shoulder range of motion. So flexion, extension, perfect, hyperextension, good. And then internal rotation, external rotation, yeah. And then abduction, good, adduction, perfect, and then circumduction, all the way around, perfect. Then I'm going to assess your shoulder girdle strength. So if you could abduct and adduct against my resistance, perfect, good, both 5 out of 5. And then I'm going to assess your light touch sensation. So if you could close your eyes and tell me where you feel this.
Right forearm.
Good.
Left forearm.
Good. And then we're going to test stereognosis. So if you can close your eyes and hold your hand out and tell me what I'm putting in your hand.
Pin.
Good. Can you tell me what I'm putting in your hand here?
Cotton ball.
Perfect. Now we're going to test graphesthesia. So I'm going to draw something in your hand. If you can tell me what it is.
A 0 or a circle.
Perfect. So we tested both of those. Now we are going to test your vibratory sensation. Okay, so I'm going to do this at the wrist on your proximal ulnar prominence.
Yep. Yep.
Okay, perfect. And then we are going to do the cerebellar coordination. So we are going to go serial finger opposition. So I want you to put, well, actually, we're going to go to each finger. Perfect. Hands in lap. Go back and forth. Perfect. And then we're going to do finger to finger. So do your nose, finger to nose, and then go back and forth. Back to your nose. Perfect. Okay. And then I'm going to test your deep tendon reflexes. Okay. So I'm first going to test your brachio radialis. Perfect. And then we're going to go to your bicep. Perfect. Tricep. Good. We're going to do patellar. Good. Then Achilles and Babinski. Perfect. Other foot. Babinski. Good. Achilles. Good. Patellar. Good. Tricep. Good. 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 Okay. Then I'm going to do your lower extremities. So scoot back so she can see you. Okay, good. So we're going to check, insect and palpate your toes. So I don't see any redness, swelling, nodules, deformities, or edema. Do you have any tenderness?
Nope.
Okay, they are symmetric, so we're going to check range of motion. So can you flex them for me? Just your toes, sorry.
Oh.
Extension. Perfect. Abduction. Adduction. Sorry, and then hyperextension. Perfect. Then I'm going to check cap refill, lesson 3, dorsalis pedis pulsus. And they're perfect. Next, we're going to go to the ankles. No redness, swelling, nodules, deformities. They're symmetric. Any tenderness?
Nope.
Okay, perfect. And we're going to do dorsiflexion. Well, we're going to do dorsiflexion first. Sorry, plantar flexion. Good. Inversion. Eversion. Good. And then rotation. Perfect. You're going to do dorsal and plantar against me. Perfect. 5 out of 5. Perfect. 5 out of 5. Okay, knees. I don't see any nodules. Swelling, edema. Do you have any tenderness?
Nope.
Good. No redness, deformities. They are symmetric. So can you flex your knee? Extend. Perfect. And then, you're going to do it against resistance. So, perfect. 5 out of 5. Perfect. 5 out of 5. Okay. If you could close your eyes and tell me where you feel this.
Right foot. Left foot.
Perfect. And then we're going to do vibratory. Good.
Yep. Feel it.
Okay. Perfect. Okay. If you could stand up for me. Good. So I'm going to palpate the hips, checking for any deformities, redness, swelling, tenderness, no tenderness.
No tenderness.
No edema, no nodules, no crepitus. They are symmetric. We're going to do range of motion. So could you do flexion for me? Extension. Perfect. Hyperextension. Good. Abduction. Good. Adduction. Did you see? Okay, perfect. And then internal rotation. External rotation. Perfect. And then circumduction. Perfect. Then I'm going to get you to do range of motion of the knees while you're standing up. So flex, extend, hyperextend. Good. And then if you could turn around for me. So I'm going to get him to flex his spine so I can check the curvature. So he's got normal curvature, no scoliosis noted. Perfect. It's expected curvature, alignment, no tenderness.
No tenderness.
Okay. So let's do range of motion for your spine. So flexion. Good. Extension, hyperextension. Good. Lateral, and then rotation. Perfect. I need you to close your eyes. We're going to do Romberg. So I'm looking for any swaying, and he has no swaying. Then I'm going to check his gait. So if you could walk normal for me. Perfect. Nice steady gait. And then heel to toe for tandem gait. Perfect. And then if you could hop in place for me. Hop on one foot. I'm sorry. Perfect. And hop on the other foot. Great. And that concludes our head to toe assessment.